in a rented apartment. 3 women were found dead. 2 were lying on the bed. 1 was in the bathroom. Their ages were 16, 18, and 22. Police preliminarily determined the cause to be carbon monoxide poisoning. On the evening of December 25, 2023, a regular family in the west of Hangzhou, on a whim, wanted to add a little warmth to the cold winter. So they decided to do some fireside tea brewing. 5-year-old Momo and her parents sat around the charcoal stove, brewing tea and roasting sweet potatoes. It was just so cozy. The weather was cold and the house was large. To make it a bit warmer, the mother closed all the doors and windows. A few minutes later, that warmth turned into danger, without any warning. Momo was playing on her tablet by the stove when she suddenly fainted and started convulsing. Her parents also immediately began to feel dizzy with headaches, nausea, and vomiting. Luckily, the mother's symptoms were still mild enough for her to move. She managed to open all the doors and windows in the house, drag her child to a ventilated area, and pull her back from death's door. In the end, the family of 3 was rushed to the emergency room at Zhejiang University Hospital. The ER confirmed it was carbon monoxide poisoning. This was not an isolated case. During that period, Zhejiang University Hospital alone treated 47 patients for carbon monoxide poisoning caused by fireside tea brewing. Some were talking gibberish, others were disoriented, and some fell into a coma, losing control of their bowels and bladder. Besides this example, there were others like the case of the professor from Hong Kong. According to other reports from Guangxi, several severe carbon monoxide poisoning incidents occurred within a few days. What's scary is that we get warnings about carbon monoxide poisoning every single year. And every year people have to be rescued. Some make it to the hospital. Others lose their lives. So why does this keep happening? Is it ignorance or just wishful thinking? What exactly is carbon monoxide? How can it, in just a matter of minutes, quickly steal a person's consciousness and even their life? And what situations pose a truly high risk? It's no exaggeration to say the horror of carbon monoxide poisoning is probably far beyond what you can imagine. So today, we're going to break down the topic of carbon monoxide poisoning and explain it thoroughly. Before we start the video, we'd like to ask for a little favor. Making these videos isn't easy, so if you could help us out with a like to show some support, we would be incredibly grateful. Your support means the world to us. Thank you, everyone. Whatever you do, it's not wrong if you don't get caught. Can you imagine that these are the words of an associate professor at the Chinese University of Hong Kong's Faculty of Medicine, an honorary senior medical officer at the Prince of Wales Hospital in Sha Tin, a fellow of the Royal College of Anaesthetists in the UK, and a fellow of the Hong Kong Academy of Medicine? On May 22, 2015, at around 2 p.m., a woman named Huang, the wife of a man named Shu, went out with their young daughter Nini. She was driving the yellow Mini Cooper that Shu had given her. However, after driving for just a few minutes, Huang started to feel unwell and pulled the car over into a bus lay-by. At 3:35 p.m., a passerby on his way home from work noticed the car, which seemed to be parked a bit carelessly. He saw that the windows were shut tight, and though it wasn't raining, the windshield wipers were on. He saw the woman in the driver's seat with her head tilted back, her mouth open and her hands hanging down. The young girl beside her had her head slightly tilted, resting against the window. At about 4:15, when he passed by the car again, he saw it was still there. Curious, he went up to take a closer look, only to find that the mother and daughter inside were completely unresponsive. As a nurse, she immediately sensed something was wrong. She tried to open the car door, but it was locked, so she called the police for help. Unfortunately, after the mother and daughter were taken to the hospital, they couldn't be saved. Meanwhile, the husband, a man named Shu, was in the middle of surgery. When he heard what happened to his wife and daughter, he rushed to the hospital. By the time he arrived, they had no breath or pulse. But then, his strange behavior caught the attention of the police officers at the scene. At the hospital, Xu only held his daughter and cried his heart out, but he completely ignored his wife's body. The medical examiner performed an autopsy that same day, and guess what they found? The carboxyhemoglobin level in both of their blood was as high as 50%. It was obvious that they had died from poisoning after inhaling a high concentration of carbon monoxide. But this clear cause of death was actually the biggest mystery puzzling the police. The police investigation found that the car involved was in perfect mechanical condition. There were no carbon monoxide leaks. So that raised the question, where did such a high concentration of carbon monoxide come from? Although Shu's strange behavior at the hospital had made the police suspicious, he had a solid alibi, so there was nothing they could do. The case hit a dead end. It wasn't until 6 months later, in November of that year, that an officer frustrated with the lack of progress remembered something from the initial search. They had found a yoga ball in the trunk that was missing its plug and was completely deflated. This set off alarm bells. They came up with a bold hypothesis, so they immediately bought a yoga ball to run an experiment. After removing the plug, the ball deflated in about 35 to 40 minutes. This proved one thing at least. Using a yoga ball to store gas was totally feasible, and pulled out the plug. So the idea that it would automatically release the gas holds up. But when they sent the ball from the car for analysis, no carbon monoxide was detected inside. After all, half a year had already passed. So, that question came up again, where did the carbon monoxide come from? The police weren't willing to give up on this lead, so they started investigating all the companies in Hong Kong where you could order carbon monoxide. And they actually found a crucial clue. On April 8th, 2015, a shipment of high-purity carbon monoxide was delivered to the Prince of Wales Hospital. And this was exactly where Kaw worked, but the person who signed for the delivery. It was an employee with the surname Chow. The police continued their investigation and finally discovered that in October 2014, the seller company had received an email inquiring about the price of carbon monoxide. The email address contained a certain character, and this was the first letter of Kaw's Malaysian name. The police questioned the signatory Chow further. It was only then that Chow mentioned this was all done according to Kaw's instructions to order and receive it. He said it was for an experiment, but he didn't know the details of the experiment. Chow also stated that he had personally seen Kaw fill a yoga ball with the gas and take it away, saying he was letting a friend check the concentration. At this point, the police could finally see more or less the full picture of the puzzle. On May 12, 2016, the police arrested Kaw for the first time. In a drawer in Kaw's study, they found a white yoga ball plug, although Kaw stated that he had many other yoga balls at home, so having a spare plug didn't really prove anything. He also stated that he brought the carbon monoxide gas home. It was purely for exterminating pests like rats. After arresting Xu, the police didn't stop their investigation. They teamed up with the government laboratory, using the private car from the incident, the carbon monoxide and the yoga balls, as well as the carbon monoxide later seized from Xu's office, to conduct an experiment. They simulated a scenario where someone had previously released the poisonous gas inside the car. They found that the fully inflated yoga ball was too large. About a quarter of the gas had to be released before the ball could be placed in the trunk. In one of the tests, an officer placed the leaking carbon monoxide-filled ball inside the car with the engine off. 5 minutes later, the carbon monoxide level inside the car was recorded at 3,400 parts per million. As the ball continued to deflate, they found that the average toxin level between 15 and 17 minutes exceeded 7,000 ppm. What does this number mean? It means it could kill everyone in the car within minutes. In 2018, the case went to trial at the High Court. Xu was charged with 2 counts of murder. The jury unanimously found Xu guilty on both counts of murder. He was sentenced accordingly to life in prison. But since we've gotten this far, let's give all you curious cats out there a quick rundown of Xu's motive. Simply put, he had a mistress who was his student. There was a 16-year age gap between them. He wanted to divorce his wife, and his wife had initially agreed, but they couldn't agree on the settlement. He was only willing to give his wife 1/6 of their assets, not the half she was demanding. They were at a stalemate for years with no resolution, because he and his wife held their property in joint tenancy. This means that if his wife were to die unexpectedly, he would become the sole beneficiary, and his wife had also purchased several insurance policies overseas. He was also the ultimate beneficiary. Therefore, thanks to new technology, of course, in reality, the process of collecting evidence in the trial was much more complicated. For example, Xu kept appealing the verdict all the way until 2025. But regardless, the jury still unanimously found Xu guilty of 2 counts of murder. Of course, the example I just mentioned is a bit on the extreme side. For us regular folks, what we need to pay more attention to is probably carbon monoxide poisoning that happens in our daily lives, especially from October to March, which is the peak season for carbon monoxide poisoning. Just how common is it? Let's look at a specific case to get the bigger picture. After you see the cases from Guangxi that happened between February 5th and 7th, 2018 over just 3 days, the cases I'm about to list, you should get a pretty concrete idea. February 5th, 2018. In Gangbai District, Guigang, a man was found by his employee collapsed in the bathroom on the 2nd floor of his shop. The floor was wet, and the shower was still running. He was sent to the hospital where doctors diagnosed that the man was already dead from suspected carbon monoxide poisoning. Still on the same day, in Chuanshan Town, Liujiang District, a 13-year-old boy was taking a shower using a gas water heater. Because he was in there for too long, his family noticed something was wrong and opened the door to check. They found the boy collapsed on the floor unresponsive. After being rushed to the hospital, the preliminary diagnosis was death by carbon monoxide poisoning. And that's not all. On February 5th, another incident occurred in the Port District of Fangchenggang. A 19-year-old employee was taking a shower in the company dormitory and hadn't come out of the room for a long time. When a colleague went to check on him, he was found unconscious in the bathroom. By the time he was taken to the hospital, he had no heartbeat and wasn't breathing. An investigation of the scene revealed a gas water heater was installed inside the bathroom. The ventilation was poor. The next day, February 6th, the tragedies continued. In Kintang District, Guigang, a 22-year-old young man passed out while warming himself with a wood fire in his room. His family found him and called for help. Despite rescue efforts, he died on the way to the hospital. On the same day in the city of Luzhou, a tragic incident in a rental apartment in Lujiang District wiped out an entire family. The 110 emergency service received a call that a family of 3 inside was suspected of having gas poisoning. When medical personnel arrived at the scene, they confirmed the 2 adults were already dead at the scene. Their daughter was rushed to the hospital but died despite emergency treatment. The preliminary conclusion was that all 3 died from carbon monoxide poisoning. Still on that same day in Babu District, Hezhou, a family called for emergency help. When the paramedics arrived at the scene, a middle-aged man was found collapsed in the bathtub. His 1-year and 8-month-old grandson was being held by his mother on the bed, who was trying to resuscitate him. But by then, both of them had already passed away. It's believed the middle-aged man was in a small, poorly ventilated bathroom bathing the child, which ultimately led to this tragedy. On February 7th, inside a rental unit in Qixing District, Guilin, 3 young women were found dead. 2 were on the bed, 1 was in the bathroom. Their ages were 16, 18, and 22. Police preliminarily determined the cause of death was carbon monoxide poisoning. The same day, in another residence in Qixing District, Guilin, a man was found dead at his bathroom door. The preliminary cause of death was determined to be carbon monoxide poisoning, and he had been dead for about 15 days. In just 3 short days, there were so many and such severe incidents of carbon monoxide poisoning, and what I've just listed is only a fraction of them. I'm sure you've all heard that. Carbon monoxide poisoning is terrifying. But did you ever imagine it was this terrifying? Some of the victims I mentioned were taking a shower, some were trying to stay warm, and some were just doing what they always do, going back to their dorm or rental to rest, only to have their lives silently stolen away. Say, after hearing all this, aren't you curious? Why is carbon monoxide so terrifying? How can it take a person's life so quickly? So now, let's talk about it from a professional perspective. Carbon monoxide poisoning. Carbon monoxide is a colorless, odorless, and non-irritating gas. Its density is slightly lower than air, and it's classified as an asphyxiant gas. If an adult stays in an environment with 600 milligrams per cubic meter for 10 minutes, or in an environment with 240 milligrams per cubic meter for 3 hours, it can lead to acute inhalation poisoning. When the concentration in the environment exceeds 5,700 milligrams per cubic meter, it can be fatal within minutes. Remember the 7,000 ppm from the first case? That's about 8,020 milligrams per cubic meter. Carbon monoxide in the environment is produced during the incomplete combustion of carbon-containing materials. In industrial settings, you can find it in steelmaking, coke production, gas manufacturing, and coal mine gas explosions, which are typical examples of occupational exposure. Common sources in daily life include leaks from gas stoves or gas pipes, using coal stoves in poorly ventilated areas, charcoal braziers, and so on, gas water heaters that are used when improperly installed, and also car exhaust. Generally speaking, this is how carbon monoxide poisons a person. When carbon monoxide is inhaled through the respiratory tract and enters the body, it rapidly binds with hemoglobin, forming carboxyhemoglobin, and competitively inhibiting oxygen from binding with hemoglobin. On top of that, it also prevents the oxygen that has already bound to hemoglobin from dissociating normally, rapidly reducing hemoglobin's oxygen-carrying capacity and the partial pressure of oxygen in the tissues, causing tissue hypoxia. We call it competition. But honestly, it's a total hostile takeover. That's because carbon monoxide's affinity for hemoglobin is more than 200 times stronger than oxygen's affinity for hemoglobin. So, when a person is in an environment with a high concentration of carbon monoxide and the CO enters their bloodstream through the respiratory tract, acute carbon monoxide poisoning occurs, in addition to the main classic hypoxia mechanism I just mentioned. An expert consensus on the diagnosis and treatment of acute carbon monoxide poisoning published in 2022 also mentioned that the poisoning mechanisms of carbon monoxide also include inhibiting mitochondrial function, inducing an immune inflammatory response, damaging the myelin sheath, and causing direct harm by binding with myoglobin. I'm not going to elaborate on these points. You wouldn't get it even if I did. The on-screen tips provide a simple introduction, so feel free to memorize those. Now, as for the clinical symptoms of carbon monoxide poisoning, they mainly manifest in the nervous system, cardiovascular system, and respiratory system. For instance, nervous system symptoms mainly include lightheadedness, dizziness, drowsiness, and coma. The cardiovascular system can experience an abnormal heart rate, especially with signs of acute coronary syndrome. Respiratory symptoms often manifest as difficulty breathing, increased airway secretions, and signs of pulmonary edema. The severity of these clinical manifestations is related to the concentration of carboxyhemoglobin in the blood. Based on the severity, poisoning is classified into mild, moderate, and severe types. Mild poisoning occurs after a short exposure, with a carboxyhemoglobin level in the blood between 10 to 20%. Clinical symptoms are mainly caused by a lack of oxygen to the brain, such as headaches and dizziness, ringing in the ears, blurred vision, nausea and vomiting, weakness in the limbs, and even brief fainting spells. If you quickly get away from the toxic environment and breathe fresh air, the symptoms can disappear rapidly, usually with no long-term effects. Moderate poisoning occurs after a longer exposure, with a carboxyhemoglobin level in the blood between 30 to 40%. In addition to the symptoms of mild poisoning, the skin and mucous membranes will also turn a cherry red color. The face becomes flushed, with heavy sweating and a rapid pulse. The person may walk unsteadily, feel confused, drowsy and weak, and have impaired judgment. They might experience hallucinations, fall into a light coma, and have sluggish light and corneal reflexes. With prompt medical attention, the person can wake up quickly and make a full recovery within a few days, usually with no lasting complications. Severe poisoning occurs when it's discovered too late, after too much carbon monoxide has been inhaled. The carboxyhemoglobin level in the blood is already over 50%. The patient will fall into a deep coma or enter a decorticate state. Various reflexes are significantly weakened or disappear, and they lose control of their bladder and bowels. Their lips and face will be pale or bluish, and they'll be sweating profusely. Their body temperature will rise, their blood pressure will drop, and their breathing will be suppressed. The mortality rate for patients with severe poisoning is high, and survivors may have serious long-term complications, such as delayed encephalopathy from acute carbon monoxide poisoning. After a false recovery period of 20 to 60 days, these patients may start having trouble concentrating and experience memory problems, personality changes, psychosis and Parkinson's-like syndromes, and other neurological after-effects. We'll dive deeper into this point in the next chapter. Additionally, based on the speed of onset, carbon monoxide poisoning can be divided into fulminant, acute, and chronic types. The first two are more common. Fulminant poisoning is often caused by inhaling a high concentration of carbon monoxide in a short period. The victim may suddenly collapse, lose consciousness, and their reflexes may disappear, leading to death in a short time due to paralysis of the respiratory center. In the early stages of acute poisoning, the victim feels a heaviness in their head, followed by a severe headache, chest tightness, nausea, weakness in the limbs, and ataxia. At this point, although they are still conscious, the victim is too weak to escape the dangerous situation and save themselves. This is why when forensic examiners investigate the scene, they often find the victim in a crawling position heading towards a door or window. If inhalation continues, consciousness will quickly become blurred, blood pressure will drop, and they may lose control of their bladder and bowels, experience cardiac arrhythmia, convulsions, or rigidity. In severe cases of poisoning due to cerebral edema, the person will fall into a deep coma and ultimately die from respiratory failure. Now about the after effects of carbon monoxide poisoning. This is a very important point, but one that's often overlooked. So, I think it's necessary to expand on this a bit more for everyone. The after effects of carbon monoxide poisoning are also known as the secondary injury of CO poisoning. The professional term is delayed encephalopathy due to carbon monoxide poisoning or residual neurological sequelae. Just talking theory will put you to sleep at this point, although they are still conscious. So to make things easier for you, I'll start with a simple case study to give you all a feel for what delayed encephalopathy caused by carbon monoxide poisoning is really like. There was this guy not even 30 years old who got carbon monoxide poisoning from burning charcoal. So even though he was found and rescued, by the time he got to the hospital, he was already in a deep coma. After a few sessions of hyperbaric oxygen therapy, his consciousness had returned by the time he was discharged. Aside from some minor after effects like his movements being a bit slow, he was pretty much back to normal. But over the next 3 weeks, his reaction time, memory, and mobility started to gradually get worse again. During his hospital stay, his limbs and torso became rigid. When he walked, his body would lean to the right, so he needed someone to help him. He also showed signs of mutism. You'd have to ask him the same question over and over before he would finally utter a few words. Most of the time, he would just sit there quietly playing with his hands, and he had a noticeable grasp reflex. His brain MRI showed that, in addition to changes in the bilateral globus pallidus, there were abnormal signals and swelling throughout the entire cerebral white matter region. which is a classic sign of delayed encephalopathy. What I've just described is a severe neurological after effect that can manifest after carbon monoxide poisoning. According to statistics, about 3 to 40% of poisoning patients will develop what's known as delayed encephalopathy. Its neurological symptoms appear after a period of time, gradually emerging, for example, 1 to 3 weeks later. These neurological symptoms, just like in the case I mentioned, often include a decline in memory and executive function, speaking less or even becoming completely silent, body rigidity, an unsteady walk, and even some strange behaviors. As a result, these patients also often exhibit signs of depression. And even psychiatric symptoms like inappropriate laughter can also be mistaken for depression or psychosis. So why does delayed encephalopathy after carbon monoxide poisoning even happen? As one of the most common complications of acute carbon monoxide poisoning, its occurrence isn't simply caused by an acute lack of oxygen. There are other complex mechanisms at play. Although they haven't been fully figured out yet, a lot of research suggests that immunological mechanisms might be involved in its onset and play a major role. This includes immune-mediated inflammatory demyelination, cellular immunity and proliferation, and the involvement of cytokines. Other studies have also found that vascular factors, which cause neuronal apoptosis and necrosis, due to insufficient blood supply, might also be involved. This part is honestly way too sleep-inducing, so we're not going to get into it. For students studying for your postgrad exams, feel free to look up the references in the video description. As for everyone else, understanding the following risk factors for developing the condition is still really important. According to the Chinese expert consensus on the diagnosis and treatment of delayed encephalopathy after carbon monoxide poisoning, there are mainly 4 categories of risk factors, as shown on the screen. You can all take a look. Therefore, for patients and their families, it's crucial to pay close attention to the patient's behavior and reactions within 1 to 2 months after the poisoning. If anything seems off, seek medical help immediately. It's no exaggeration to say that the risk of carbon monoxide poisoning lurks around every single one of us. However, when it comes to carbon monoxide poisoning in our daily lives, it is to a large extent completely preventable. Next, based on an article from the Chinese Center for Disease Control and Prevention, we've put together a list of some preventive measures against carbon monoxide poisoning in daily life. For instance, using charcoal fires for heating in enclosed spaces. Emergency response principles. First and foremost, prevention. Here are 4 of the most dangerous scenarios for carbon monoxide poisoning as summarized by official sources. These are the situations where it's most likely to happen. First, home kitchens with poor ventilation. Second, bathrooms with improperly installed water heaters. Third, inside a sealed car with the air conditioning on. And fourth, any poorly ventilated room where gas or coal is being used. The first, second, and fourth points should be pretty easy to understand. This is mainly for heating devices like charcoal fires and coal stoves. When using them, you have to frequently ventilate the room. As for gas appliances used in the home, like gas water heaters and gas stoves, be sure to choose a reputable brand and have them installed according to regulations. Get them inspected regularly and keep the area ventilated when they're in use. Also, if you use any of these devices indoors, you can install a carbon monoxide detector. Prevent the danger before it ignites. Now let's focus on that third point, because a lot of people might not be familiar with this one. The reasons for carbon monoxide poisoning related to gas-powered cars. And this is incredibly important. When a car is driving, air flows into the engine compartment. The exhaust fumes, which contain carbon monoxide, are pushed out and away by this airflow. So the carbon monoxide level inside the car won't get dangerously high. It's not a danger to anyone inside. However, when a car is parked with the engine idling, there's no external airflow. The exhaust fumes with high levels of CO can't be cleared away from the engine compartment. They can build up and seep into the passenger cabin. If someone inside the car is running the AC at this time, the AC's air circulation system will pull in large amounts of those fumes from around the engine and exhaust pipe. And the carbon monoxide from the exhaust will continuously build up inside the cabin. And that accumulation can become dangerous. So please everyone remember this. Running the AC in a sealed car while it's idling is extremely dangerous. So please remember, idling in a sealed car with the AC on is extremely dangerous. In a sealed car with the AC on is extremely dangerous, whether it's winter or summer. Using internal or external air circulation, you should never ever do this. So what if our unlucky friend Cheng gets poisoned? What should you do? First, you need to quickly cut off the source of the carbon monoxide. For example, by turning off the gas valve. At the same time, immediately open the windows to get the air circulating, and avoid using things like lighters that can easily create a spark of items. Second, get out of the toxic environment quickly. Move the patient away from the scene of the poisoning. Take them to a well-ventilated area and loosen the victim's collar. to keep their airway clear. At the same time, make sure to keep them warm to prevent complications. The patient should rest quietly and avoid any activity that would increase their oxygen consumption. If you have access to it, get the patient on oxygen as soon as possible. For patients with moderate to severe poisoning, while performing first aid on the scene, you should immediately dial 120 for an ambulance to get them to a hospital for emergency treatment as soon as possible. When it comes to carbon monoxide, there are also quite a few misconceptions. I suggest everyone pay close attention to this part too. Some people think you can only get poisoned from burning coal. But the truth is any carbon-based fuel, as long as it's burning in a low-oxygen, poorly ventilated environment, can potentially produce large amounts of carbon monoxide. Whether it's gasoline, kerosene, regular coal, or even so-called eco-friendly charcoal, none of them are exceptions. Other people think that leaving a crack in a door or window means they'll be fine. But what they don't realize is, if that crack isn't in the right place, there's still a hidden danger. Carbon monoxide is slightly less dense than air, so if the crack in the door or window is too low, or if there isn't enough air circulation, the carbon monoxide can easily build up inside the room. Many families have installed a chimney or a flue thinking they're completely safe. But in reality, if there's a strong downdraft or a blocked flue, the fumes can't escape. Also, many families use old range hoods or hoods that are too small or aren't installed high enough. This can also prevent carbon monoxide from venting properly, leading to poisoning. Of course, there are also some old wives' tales that people use to feel safe. For example, putting a basin of clean water next to the stove, thinking it'll prevent poisoning. But carbon monoxide barely dissolves in water. So as for this method preventing poisoning, you can't say it does absolutely nothing, but you could also say it does absolutely nothing. And don't even get me started on forcing a poisoned person to drink vinegar or pickled cabbage soup. That's just nonsense. In the end, the carbon monoxide might not kill them, but they might choke to death instead. Looking at the situation in China, the provinces with the highest rates of carbon monoxide poisoning are mainly in the northeast, north and central regions. There's a clear seasonal pattern to it. The peak season for poisonings is from November to March, according to the latest data. In 2019, the number of carbon monoxide poisoning cases in China was 240,300. The burden of the disease is more severe among men children, adolescents, and the elderly. And the burden is even greater for men. Besides a higher risk of occupational exposure, it might also be related to female physiology. Compared to men, women have smaller red blood cells, and fewer of them, so they show symptoms of poisoning earlier. This means they might seek medical help sooner, which reduces fatalities. Now, if we look at it from a global perspective, a study from 2020 showed that the cumulative incidence and mortality rates for carbon monoxide poisoning were respectively 1.37 per million and 4.6 per million. Another study showed that in 2021, the number of deaths caused by carbon monoxide poisoning worldwide was about 28,900. The rate for men was a little more than double that of women, and the regions with higher mortality rates were mainly in Eastern Europe and Asia. All in all, the key to avoiding carbon monoxide poisoning is still prevention. Every year, the relevant authorities put a lot of effort into public awareness campaigns, but every year there are still many tragedies. So please don't think it won't happen to me. Especially in the 4 dangerous scenarios I mentioned earlier, you must be extra careful. We're not talking about this to fearmonger, but because we feel that when it comes to protecting ourselves, we need to have a bit of street smarts to deal with life. Whether it's guarding against that colorless, odorless, toxic gas, or managing our appearance when we go out, essentially, it's all about fighting against potential problems. And speaking of which, I have to mention our old friend, Mandy Minoxidil. But some of you dealing with the hair loss might worry whether this stuff actually works, or if you can ever stop using it once you start. First of all, you can rest assured. According to the 2023 Chinese clinical guidelines for the diagnosis and treatment of androgenetic alopecia, there is ample clinical evidence confirming that minoxidil significantly improves both hair density and diameter. And it's the only recommended topical medication. At the same time, the guidelines also point out that consistent use is very important. Or, to put it another way, it's actually a bit like working out to maintain your physique. We know that hair loss and even baldness is basically caused by the gene for androgenetic alopecia. This gene is like a clock that's always ticking. While you can't turn it off, you can choose how to respond to it. It's like a clock that's always ticking. While you can't turn it off, but you can choose how to respond. The reason we stick with Mandy isn't because our bodies can't live without it. It's because we are proactively giving a protective shield to the hair follicles that are being affected by our genes. This isn't a passive dependency. It's a form of long-term management. It's just like needing to brush your teeth every day to keep your mouth clean, or going to the gym regularly to fight off that middle-age spread. Managing male pattern baldness isn't something that happens overnight. It's a long-term rational and predictable process. But the good news is, the second-generation minoxidil foam has improved skin absorption efficiency, which greatly shortens the time it takes to see results. And once you get that positive feedback, it's much easier to stick with it. Plus, with the applicator, it's not like the liquid formulas that get messy all over your head. Twice a day, 5 minutes each time, is all it takes to manage your own hair growth. So for all my friends out there who are dealing with hair loss and want to regrow it, don't waste any more time. Give this Mandy hair growth foam a try. Alright, that's all for this video. I'm Shu Chenggong. See you next time.